Good morning. My presentation is on hydro-free mechanical delamination, which is a novel technique in PPC, a retrospective analysis in 60 eyes. We all know posterior polar cataract is a rare form of congenital cataract, and the incidency is somewhere around 3 to 5 per 1,000 cases. And there is a chance of posterior capsular rupture or nucleus drop because of the
Please set the timer properly.
Because of the
Please start
abnormal.
the timer.
Please start the timer from 0.
Yeah.
5. Okay, now please.
Because of the abnormal adhesion of the posterior polar opacity to the posterior capsule, there is a chance of PCR or subsequent nucleus drop. So the incidency of PCR ranges from 4% to 36%. In the older studies, it used to be very high, but because of the improvement in the surgical technique, better understanding of the cataract and experience of the surgeons, the incidence of PCR has significantly decreased. And the last paper which was presented on this showed a PCR rate of 4%. The purpose of the study is to analyze the outcome of hydro-free mechanical delamination in a case of posterior polar cataract. Here, this is an animation and a clay model showing the procedure. We use a Sinskey hook or even a bent cystitome to create a 360-degree partial thickness groove between the endonucleus and the epinucleus. It's totally hydro-free procedure. And once that is done, the endonucleus is emulsified, and the similar procedure is repeated. The delineation is done between the epinucleus and the cortex, and the epinucleus is then emulsified or phacoaspirated, and then we do a cortical cleanup and place the lens. So throughout the antechamber is maintained, and the contour of the cornea and the globe was maintained throughout, and we use phaco was done using slow motion technique and with the reduced parameters. So all the patients underwent thorough preoperative evaluation. Thorough slit lamp evaluation was done to assess the status of the posterior capsule, and anterior segment OCT was done only in 41 of 60 cases, and in one case we could see a PC defect, and this is a case. The surgery was done under peribulbar anesthesia here, but most of the cases we even did it under topical. And Sinskey hook is used to create a delineation between the endonucleus and the epinucleus, and the separation of the corticocapsular adhesion was also done using the same instrument, and then the endonucleus was emulsified under the cover of epinuclear cushion, and the epinucleus was then emulsified, and throughout the chamber was maintained, and then a 360-degree cortical cleanup was done. So the hydro was avoided just to prevent any inadvertent escape of fluid into the subcapsular space. So we included 60 cases of 54 patients, of which 48 underwent unilateral surgery and 6 bilateral, and the follow-up period ranged from 6 to 25 months with an average of 12 months. And of the 60 cases, 57 were soft cataracts, and only 3 had a moderate degree hard cataract, and mechanical delamination was possible in all the cases, and we could place the lens in the bag. So only one patient had a pre-existent PC rupture was there in the beginning, and this is the same case wherein we did the same procedure. after the emulsification of the endonucleus, since it was a very soft cataract, we could do a irrigation aspiration to clean the cortex and place the lens. So the procedure of phacoemulsification in a case of PPC is challenging, and the approach to a case of PPC requires modification in the surgical technique. Our technique of hydro-free mechanical delamination is easier to master and with encouraging results. Thank you very much.
This is the first time I have heard of a totally hydro-free. How do you achieve it? I don't know. How do you achieve hydro-free? Hydro-free, because a wave of fluid has to go to be able to separate the endonucleus from the epinucleus. And how do you achieve it? Won't you, if you try to rotate it, won't you damage the zonules? Because if you put extra pressure on the zonules.
Yeah, we have selected cases which were soft cataract. Almost all the cases except 3 cases were soft cataracts, and we usually by doing a delineation mechanically will be damaging the zonules, but this was a very soft cataract. Easily we could delineate using a sharp instrument. The horizontal chopper I have used in most of the cases, and a long Sinski hook in some cases have used, and even the endonucleus from the epinucleus and the epinucleus from the cortex was delineated before aspirating or emulsifying it. So we could do it easily in all these cases. It works very well. There may be some accidental escape of fluid into the subcapsular space while doing phacoemulsification, but intentionally it was not done.
All the cases in AIOS2025 had no pre-existing defect. Was it like that?
We could do it in 41 cases out of 60 cases. In the 41 cases, only one had a PC, defective PC.
What was confirmed on an anti-sanguine OCT?
Yes, sir.
Yeah. Was that case also in the
that is the case. The second case which I have shown, where I have implanted a multifocal toric lens. It was implanted in the bag. There was a small defect which was not enlarged during the surgery. It was maintained.
Okay, doctor. Thank you.